On behalf of the Centers for Medicare and Medicaid Services, CMS, Division of Tribal Affairs, I would like to welcome everyone to an all tribes consultation webinar. My name is Erin Irvine and I work for Kaufman and Associates. I'll be your moderator today. Today's webinar is titled A Guide to Original Medicare and Medicare Advantage for Tribal Medicare Beneficiaries. Please note this webinar series is supported by a contract awarded to the Centers for Medicare and Medicaid Services. At this time, I will be turning it over to Beverly Lofton.
Thank you so much, Erin. Hi, I'm Beverly Lofton. I am a senior policy advisor here in the Division of Tribal Affairs at CMS. So welcome to today's webinar. This webinar is being held by the CMS Division of Tribal Affairs. During the webinar, the presenter will discuss the differences between original Medicare and Medicare Advantage and how those differences impact tribal Medicare beneficiaries and Indian healthcare providers. This guide is intended to serve as a resource to help tribal elders, caregivers, and assisters in knowing what information to consider while making their very important decisions about Medicare coverage. Any cleared materials related to this presentation can be downloaded from the Spotlight page of the CMS American Indian and Alaskan Native Outreach and Education website that can be found at go.cms.gov/AIAN. The website link will be added to the chat. So now we are pleased to be joined on this webinar by Stacy Novogorets. Stacy has been working with DTA since June as a graduate student intern. She will be graduating this month from the University of Wisconsin-Madison with her master's degree in public affairs and public health. I will now turn it over to Stacy to begin today's presentation. Stacy.
Great. Thanks so much, Beverly. And good afternoon, everyone. Thank you for joining today to learn about the differences between original Medicare and Medicare Advantage for tribal members. So I'm presenting this topic because we understand that navigating Medicare options can be a daunting task for tribal elders. Elders may not be aware of Medicare coverage and benefit options, particularly the differences between original Medicare and Medicare Advantage. They also may not consider if their Indian healthcare provider is in a Medicare Advantage plan's network. If the provider is not in network, the provider may be paid less or not at all for some of the services delivered. Further, tribal elders enrolled in a Medicare Advantage plan may be limited to doctors and facilities in the plan's network, and covered medications may also be different. Ultimately, we want to advance health equity among American Indians and Alaska Natives. So this presentation aims to provide helpful information about Medicare coverage and its benefits, including Medicare Advantage or Part C. We want tribal elders to feel confident in their decisions about what Medicare options are right for them after weighing the different pros and cons. A key point I will stress throughout this presentation is that before enrolling in a Medicare Advantage plan, tribal members should contact their Indian healthcare provider. Benefit specialists can help them make sure that the plan is right for them based on the services that they receive from their Indian healthcare provider. So to get started, we'll review some high-level basics about Medicare, including eligibility, the difference between the four parts of Medicare, and enrollment. On several of the slides, there are links to other resources which can provide additional details. So according to 2024 data, Medicare provides health insurance for over 66 million people in the US who are 65 and older, who are under 65 with certain disabilities, and who are entitled to Social Security disability insurance benefits for 2 years. People of any age who have end-stage renal disease or rather a permanent kidney failure requiring dialysis or kidney transplant, as well as people with ALS, also known as Lou Gehrig's disease. Medicare is also available to a very small subset of people who have asbestos-related conditions associated with a federally declared environmental hazard. Currently, it's only applying to people affected by the hazard in Libby, Montana. And people who immigrate to the US may qualify for Medicare if they're in a lawful status. Generally, you must have resided in the US for 5 continuous years to be eligible for Medicare. Tribal members may wonder why they should consider getting health insurance in the first place when they are eligible for healthcare from Indian healthcare programs, including Indian Health Service or IHS, their tribe, or an urban Indian health program. Having insurance can help cover some services that Indian healthcare programs do not provide. Additionally, enrolling in Medicare has benefits for them, their family, and their community. They will have greater access to health services, their tribal health program will receive increased resources, and they will be contributing to a healthier community. For more information about Medicare and eligibility, you can go to the Medicare and You Handbook, which is mailed to every Medicare household each year in the fall. You can also visit medicare.gov/Medicare and You to view and download it electronically. It's sent to all newly enrolled people as well when they're becoming eligible. It explains Medicare and provides information on Medicare health and drug plans in their geographic area. So this is a really great resource. Now we'll turn our attention to the different parts of Medicare, A, B, C, and D. Medicare Part A is hospital insurance, which covers things like inpatient care in a hospital and care provided by a skilled nursing facility, hospice, and home health. Medicare Part B, on the other hand, is medical insurance that helps cover medically necessary doctor services, outpatient care, home health services, durable medical equipment, and other medical services. It will also cover many preventive services. You usually don't pay a monthly premium for Part A coverage if you or your spouse paid enough Medicare taxes while working. This is sometimes called premium-free Part A. Federal Insurance Contributions Act, or FICA tax, is a U.S. federal payroll or employment tax imposed on both employees and employers to fund Social Security and Medicare. About 99% of people with Medicare don't pay a Part A premium since they've worked at least 40 quarters or 10 years of Medicare-covered employment. Enrollees 65 and over and certain persons with disabilities who have fewer than 40 quarters of coverage pay a monthly premium to get coverage under Part A, unless they get benefits through a spouse or family member's record. If you aren't eligible for premium-free Part A, you may be able to buy Part A if you are 65 and older and you've enrolled or are enrolling in Part B and meet the citizenship and 5-year residency requirements, or you're under 65, have a disability, and your premium-free Part A coverage ended because you returned to work. If you're under 65 and have a disability, you may continue to get premium-free Part A for up to 8.5 years after you return to work. In most cases, if you choose to buy Part A, you must also have Part B and pay monthly premiums for both. The amount of the Part A premium depends on how long you or your spouse worked in Medicare-covered employment. If you aren't eligible for premium-free Part A and you don't buy it when you're first eligible, your monthly premium may go up 10% for every 12 months you didn't have the coverage. You'll have to pay the higher premium for twice the number of years you could have had Part A but didn't sign up. It is important to know that you must have Part A and Part B if you fall into any of these different scenarios. So you want to buy a Medicare supplement insurance policy or Medigap policy, which we'll talk about more in a moment. You want to join a Medicare Advantage plan. If you're eligible for TRICARE for Life or TFL, TFL provides expanded medical coverage to Medicare eligible uniformed services retirees 65 or older, to their eligible family members and survivors, and to certain former spouses. However, if you're an active duty service member or the spouse or dependent child of an active duty service member, you may want to enroll in Part A, but you don't have to enroll in Part B to keep your TRICARE coverage. When the active duty service member retires and coverage changes to TFL, you must enroll in Part A and Part B to keep your TFL coverage. You'd also have to have Part A and Part B if you're eligible for Civilian Health and Medical Program of the Department of Veterans Affairs, or CHAMPFA. And finally, if your employer coverage requires you or your spouse or family member to have it because the company has fewer than 20 employees, you would want to talk to your employer or your union benefits administrator if that's the case. To cover some of the health services and supplies that are not covered by Part A and Part B, you can buy a supplemental policy, also known as a Medigap policy, which would be sold by a private insurance company. Depending on the policy, it may cover co-payments, co-insurance, deductibles, and other services and supplies. If you have questions about these types of costs, I would suggest reviewing the CMS Tribal Glossary that's linked here. If you have a Medicare Advantage plan, which we'll cover shortly, you would not be able to purchase a Medigap policy, so this wouldn't apply. While Medigap policies may cover some expenses not covered by Medicare Part A or Part B, they won't generally cover services such as long-term care, vision, dental, or hearing services. Medicare Advantage plans may cover some of these expenses, but keep in mind that Medigap and Medicare Advantage are not the same, even though they are both offered by private insurance companies. And you can get more information about Medigap policies at that link below. Just a brief word of caution, if you have a Medicare Advantage plan already, you do not need a Medigap plan. So as I said, you wouldn't get both of them. However, if you have a Medigap plan and you're considering enrolling in Medicare Advantage, you should talk with your Indian healthcare provider or your Medigap policy provider before making that switch. Some tribal members have had Medigap policies through their state pensions, for example, and have been unable to restart them after moving to a Medicare Advantage plan. Let's now talk more about what Medicare Advantage is. Medicare Advantage plans, sometimes called Part C, are offered by Medicare-approved private companies that must follow rules set by Medicare. If you join a Medicare Advantage plan, you'll still have Medicare, but you'll get your Part A and Part B coverage from the Medicare Advantage plan, not original Medicare. Most Medicare Advantage plans include drug coverage or Part D. In other words, a Medicare Advantage plan is just another way to get your Medicare Part A hospital insurance and Part B medical insurance coverage. In most cases, you'll need to use healthcare providers who participate in the plan's network. Some plans offer out-of-network coverage. Most Medicare Advantage plans cover at least some of the expenses we outlined earlier, such as vision, dental, and hearing services and supplies. If you choose a Medicare Advantage plan, your plan may give you a card to use when you get health services and supplies. Your Medicare Advantage Plan ID card is your main card for Medicare. However, you also may be asked to show your Medicare card, so you should carry that card too. Only give the Medicare number to doctors, pharmacists, other healthcare providers, your insurers, or people you trust to work with Medicare on your behalf. That brings us to Part D, which is Medicare prescription drug coverage. Like Medicare Advantage, Part D coverage is offered through private insurance companies. So Medicare contracts with private insurance companies that offer drug plans to people with Medicare. And this is an optional service or Medicare plan that you can get. Everyone with Medicare can get Medicare drug coverage by enrolling in a Medicare drug plan. If you join late, you may have to pay a penalty for as long as you have a Medicare drug plan. You may get this coverage from a Medicare Advantage plan that has drug coverage, but to join Medicare Advantage, a Medicare Advantage plan, you must have Part A and Part B, as we talked about earlier. Each plan has a formulary or list of covered drugs. The formulary for each plan must include a range of drugs in the most commonly prescribed categories. This ensures that people with different medical conditions can get the treatment that they need. All Medicare drug plans generally cover at least 2 drugs in each category of drugs, but plans can choose which specific drugs are covered in each category. All plans must cover a range of drugs that people with Medicare take, including most drugs in certain protected classes, which include cancer drugs, HIV/AIDS drugs, antidepressants, antipsychotics, anticonvulsants, and immunosuppressants. Also, Medicare drug plans must cover all commercially available vaccines, including the shingles shot, but not vaccines covered under Part B like flu and pneumococcal shots. You or your healthcare provider can contact your Medicare drug plan for more information about vaccine coverage. Formularies are subject to change and can be changed by the plan. Your plan will notify you of any formulary changes that affect drugs you're taking. Plans may have preferred pharmacies. If you use a preferred pharmacy, your out-of-pocket costs may be lower. People with limited income and resources may be able to get extra help paying for their Medicare drug plan costs. For more information about extra help, you can go to the link that's on the slide. Additionally, as a tribal member, may be able to have creditable prescription drug coverage through the Indian Health Service. And more information about creditable coverage can be found in the Medicare and You Handbook. So if you don't have Medicare and you're eligible for premium-free Part A, you can sign up for Part A anytime you're eligible. Your coverage will begin up to 6 months back from when you apply, but it won't start earlier than when you were first eligible for Medicare. If you have to buy Part A, you can only enroll during specific enrollment periods. Generally, your first opportunity to enroll in Medicare Part A and Part B is during your initial enrollment period. If you don't sign up for Part B during your initial enrollment period, you then have to wait until the next general enrollment period, or you may have a chance to sign up for Medicare during a special enrollment period. If you already have Medicare, you can make changes to your coverage during the open enrollment period, the Medicare Advantage open enrollment period, a 5-star enrollment period, or in certain circumstances during a special enrollment period. Enrolling in Medicare or changing how you get your Medicare are important decisions. These actions must be done timely to avoid late enrollment penalties and to be sure you get coverage that you need when you need it. You can find more information about the different enrollment periods on the link on the slide. So hopefully it's clear now when enrolling in Medicare that you do have this key decision to make, whether you enroll in original Medicare or Medicare Advantage. When making this decision, you'll want to consider your options carefully and make sure you understand the differences between original Medicare and Medicare Advantage. As we've talked about with original Medicare, coverage includes Part A and Part B. If you want drug coverage, you can join a separate Medicare drug plan to get Medicare drug coverage, Part D, as we've talked about. You can use any doctor or hospital that takes Medicare anywhere in the US to help pay for your out-of-pocket costs in original Medicare, such as the 20% coinsurance. You can also shop for and buy a Medigap or supplemental coverage policy. You can use coverage from a former employer or union or Medicaid if that's available to you. Medicaid, just as a quick note, is a joint federal and state program that helps with medical costs for some people with limited income and resources. It also offers benefits not normally covered by Medicare, like nursing home care and personal care services. With Medicare Advantage, or Part C, you would get a Medicare-approved plan from a private company that offers an alternative to original Medicare for your health and usually drug coverage. These bundled plans include Part A, Part B, and usually Part D. Plans may have lower out-of-pocket costs than original Medicare. In most cases, you'll need to use doctors who are in the plan's network. Plans may have some extra benefits, as I've talked about before, like vision, hearing, and dental services. One key difference that tribal members should consider when deciding between original and Medicare Advantage is that with original Medicare, they can go to any doctor or hospital that takes Medicare. And if they see an Indian healthcare provider, that provider will be paid for Medicare covered services. With Medicare Advantage, they can still see their Indian healthcare provider, but if that provider is out of network, the Medicare Advantage plan may pay less or may not pay the Indian healthcare provider for their services. I just want to clarify quickly what we mean by in-network versus out-of-network. In-network refers to facilities, providers, and suppliers that the health insurer or plan has contracted with to provide healthcare services. An out-of-network provider, on the other hand, does not have a contract with the health insurer or plan to provide services. In this case, a tribal member would need to pay more potentially to see an out-of-network provider. With original Medicare, for Part B covered services, a tribal member would receive at non-tribal facilities. The member would usually pay 20% of the Medicare approved amount after their deductible. This amount would be the coinsurance. They would pay a premium, the monthly premium for Part B, which is deducted from the Social Security check. If they choose to join a Medicare drug plan, they would pay a separate premium for that drug coverage. Depending on which Medicare Advantage plan that they would choose, their out-of-pocket costs will vary. They would have the monthly Part B premium, and they would also pay the plan's premium. However, some plans may have a $0 premium, and they may pay all or part of the member's Part B premium. Most Medicare Advantage plans also include Medicare Part D, the drug coverage. Something unique to tribal members is that some tribes will actually cover the cost of Medicare premiums on behalf of tribal members. This is called sponsorship, and it is provided under Section 402 of the Indian Healthcare Improvement Act. If this applies to you, you'll want to talk to your tribe to see if they will sponsor your premium. So I would recommend talking to your Indian healthcare provider. In terms of other cost differences, there are some between Original Medicare and Medicare Advantage. With Original Medicare, there is no yearly limit on what you pay out of pocket unless you have supplemental coverage like a Medigap policy. Out-of-pocket costs should be limited if you see an Indian healthcare provider, though. You can also choose to buy Medigap to help pay your remaining out-of-pocket costs, like the 20% coinsurance, or you may be able to use coverage from a current or former employer, union, or Medicaid. With Medicare Advantage, you will have a yearly limit on what you pay out of pocket. And once you reach your plan's limit, you'll pay nothing for services Part A and Part B cover for the rest of the year. Also, as I mentioned earlier, you wouldn't buy a Medigap policy if you have Medicare Advantage. In terms of coverage, Original Medicare covers most medically necessary services and supplies in hospitals, doctors' offices, and other healthcare facilities. It doesn't include some benefits like eye exams, most dental care, and routine exams. In most cases, you don't need approval for Original Medicare to cover your supplies or services. With Medicare Advantage, plans must cover all medically necessary services that Original Medicare covers. Plans may also cover some extra benefits that Original Medicare wouldn't cover, like vision, hearing, and dental. In many cases, you may need to get approval from your plan, however, before it will cover the cost of some of those services and supplies. When it comes to prescription drug coverage with Original Medicare, you would need to join a separate Medicare drug plan to get the Part D coverage. In contrast, with Medicare Advantage plans, most include Part D coverage, so you wouldn't have to join a separate Part D plan. For tribal members who are located near the US border or travel outside of the US, it's probably worth noting that Original Medicare doesn't cover medical care outside of the US. You may be able to purchase a Medigap policy that would cover emergency care outside of the US. If you have Medicare Advantage, you likely won't be covered outside of the US either, though some plans may offer a supplemental benefit for emergency or urgent care outside of the country. Given these differences between Original Medicare and Medicare Advantage, let's talk about some of the specific things that tribal members should consider when deciding which Medicare option makes sense for them. First and foremost, one of the key considerations is whether the tribal member regularly sees an Indian healthcare provider and if that provider is part of the Medicare Advantage plan's network. With Original Medicare, you can continue to see your Indian healthcare provider, and most Indian healthcare providers are reimbursed for Medicare covered services provided. If the Indian healthcare provider is not in network for the Medicare Advantage plan, however, you could still see the Indian healthcare provider, but the plan may pay the provider less or not at all for the Medicare covered services provided, which could reduce the resources coming into the tribal community. If you may ever see a specialty provider, such as a cardiologist or podiatrist, you'll want to consider some differences in access. With Original Medicare, you can go to any specialist or hospital that accepts Medicare. With Medicare Advantage, you will generally be limited to specialists and facilities in the plan's network, and you may need a prior authorization to see certain providers or receive specific services. This is not to say that you can't see an out-of-network provider, but if you do, you will likely have to pay more. Tribal members may be accustomed to their Indian healthcare provider coordinating and paying for referrals through the Purchased Referred Care Program, or PRC, formerly known as Contract Health. If they have Original Medicare, their Indian healthcare provider will coordinate those referrals and often pay any Medicare deductibles, copays, and coinsurance. Their Indian healthcare provider can provide additional information about PRC eligibility and payment authorization. If a tribal member has a Medicare Advantage plan, they will likely be directed to see an in-network provider, since only certain Medicare Advantage plans provide coverage for out-of-network care. If the tribal member goes to an out-of-network provider, as I mentioned earlier, they'll likely have to pay more. People commonly need medications from a pharmacy. If a tribal member has Original Medicare, they may choose to enroll in a Part D plan if the medications are not available or covered by their Indian healthcare provider. A Part D plan allows the Indian healthcare provider pharmacy to bill the plan and meet the deductible of the member. This not only benefits the Indian healthcare provider, but it may also eliminate a significant or significantly reduce any out-of-pocket costs the tribal member has when they fill a prescription through an outside pharmacy. Some tribes have Part D sponsorship programs that will pay the premiums. In the case of Medicare Advantage, not all plans include pharmacy benefits for American Indians and Alaska Native enrollees if they know that an Indian healthcare provider provides a pharmacy benefit. If your Indian healthcare provider does not cover a medication, you would be responsible for all of the costs. If you are currently enrolled in a Part D plan sponsored by a tribe, your Part D plan may be canceled if you select a Medicare Advantage plan that includes prescription drug coverage. Finally, if you are receiving calls about signing up for Medicare, never say yes over the phone without first checking with a trusted advisor or an Indian healthcare provider patient benefit coordinator. Medicare is never going to call you about original Medicare. However, Medicare Advantage agents and brokers may contact you directly. They'll also use advertisements, TV, radio, mail, social media, telemarketing. Celebrities are often used to catch your attention. It's important to recognize that agents and brokers receive commissions for enrolling members in Medicare Advantage plans, and there is no financial incentive for them to enroll a member in original Medicare. So this is an important point to remember, and I just want to emphasize it. Medicare Advantage agents and brokers may call tribal members, they may talk to them at tribal events, or contact them in other ways to encourage them to enroll during a special enrollment period. Before enrolling, we really want to encourage tribal members to contact their Indian healthcare providers to make sure the plan is right for them and that the special enrollment period is recognized if that's the case. In 2024, I just want to note that there are new rules that came out for Medicare Advantage and Part D general marketing requirements. So Medicare Advantage plans can't advertise benefits that aren't available to beneficiaries in the service areas where the marketing appears. They can't market products or plans, benefits, or costs without using their approved Medicare Advantage organization or marketing names. And they can't advertise about savings available that are based on a comparison of typical expenses for uninsured individuals, unpaid costs of duly eligible beneficiaries, or other unrealized costs of a person with Medicare. Now we want to address just some specific questions we've heard from tribal members. Most of these questions relate to the material we've covered, but we want to frame them just a little differently. So this question, will I still be able to see my direct care Indian healthcare provider if I enroll in a Part C plan? If you have original Medicare, the answer is a simple yes. You can continue to see your Indian healthcare provider since most IHS, tribes, and urban Indian clinics are reimbursed for Medicare covered services provided. With Medicare Advantage, you can always see your direct Indian healthcare provider. However, that Indian healthcare provider may not be in network. Plans may pay less or may not pay the Indian healthcare provider for the services they've provided. Therefore, you would want to check with your Indian healthcare provider before enrolling in a Medicare Advantage plan. So will you still be able to see the specialists you've been seeing? With original Medicare, yes, you can continue to see your specialists if they are Medicare providers. With Medicare Advantage, you may need to switch to an in-network specialist for that to be covered. So selecting original Medicare provides your Indian healthcare provider with more control and flexibility to address your healthcare needs. PRC will be able to approve and coordinate your referrals if that's applicable. PRC may also cover your deductible and copay costs on Indian healthcare provider referrals. Your Indian healthcare provider will be able to bill for Medicare provided services. If you have Medicare Advantage, your Indian healthcare provider may not be contracted with the Medicare Advantage plan. So payments from the Medicare Advantage plans may be lower than they would be if you had original Medicare. In addition, PRC referrals for care may be subject to prior authorization requirements and limited to the plan's in-network providers. So are insurance agents and brokers compensated for assisting with my enrollment? When it comes to original Medicare, no. Agents and brokers do not receive commission for enrolling you in original Medicare. So Part A, Part B, D. In contrast, agents and brokers receive commissions for enrolling you in Medicare Advantage plans. So as we wrap up, I again want to emphasize that before a tribal member would enroll in a Medicare Advantage plan, they should definitely contact their Indian healthcare provider to make sure the plan is right for them based on the services they receive from their Indian healthcare provider. And because we know that tribal members are often aggressively targeted for enrollment in Medicare Advantage, I just want to cover a few things that they should be on the lookout for and how they can report potential violations or concerns. So these are some red flags. They may include the following situations. You received an unsolicited phone call from a company you have no prior relationship with. A company represents itself as coming from or sent by Medicare, Social Security, or Medicaid. You received information such as leaflets, flyers, door hangers, etc. in your car or at a residence from a company that you didn't have an appointment with. Or an agent initiates a discussion about other insurance products like life insurance annuities during a visit or meeting about a Part C or Part D Medicare product. All right, these are some additional red flags to just be on the lookout for. An agent returns uninvited to your residence after missing an appointment with you earlier. You signed up for a plan after being told by a company that certain prescriptions or services were covered, but after reviewing your explanation of benefits, you found that they were not covered by the plan and you will be charged instead. You were told that you could keep your Medigap or supplemental plan when you signed up for a Medicare Advantage plan, when in reality, you can't have both a Medigap plan and a Medicare Advantage plan. So if you should encounter any of these situations or a tribal member is encountering these situations, we encourage that you report potential violations or fraud. You can visit the fraud scheme's website for more information. To report Medicare fraud, errors, or abuse, please visit the websites linked here or call the numbers listed. For more information about the topics covered today, please check out the resources listed here. And there are a variety of resources available on these websites as well, more than we've talked about today, but these will help you learn more and hopefully answer any questions you may have. Finally, for any Medicare-related questions, please visit medicare.gov or call the number listed here. You can also get Medicare enrollment assistance through your Social Security office, and your local state health insurance assistance program should be able to provide local Medicare help for you. And with that, we will wrap up and I'd be happy to take any questions.
All right, this is our time for questions. We'll first be addressing the questions that have already been submitted in the Q&A box. So it says, what is the difference between home health care Part A versus Part B?
Oh, good question. I am not as familiar with all the differences. I would see, let's see, Rachel, do you have any insight into that?
Yeah, I'm not sure what the difference is. I see that question might be coming from IHS. So I'm not exactly, Raho, if you could maybe explain a little bit more, like, what do you mean by what's the difference? Like, what would the services look like? Or maybe more of a like billing question? And we might have to take it offline, but just so I understand exactly what we're looking for.
Yeah, we may take that offline, but it is my understanding that home health services are typically Part B, unless there are some other type of services that would be considered inpatient. But
I'm wondering
likely,
if like provider based or something, Bob.
Yeah, I'm looking quick at the Medicare and You handbook. I think some of it comes down to whether the care is part-time or intermittent skilled nursing
Oh,
care.
that makes sense.
So I think probably the best way to think about it would be if it's more inpatient-like, it would be under Part A versus more outpatient-like would be Part B. But yeah, there is a section in the Medicare and You handbook that talks a bit more about that.
So it sounds like there's home care under, both parts. So I don't see that Raho followed up. But Raho, if we have any more like detail on that question, just let us know and you know where to find us.
The next question is in regard to sponsorship programs. You said that this is under the Indian Healthcare Act, or which act?
I believe it's the Indian Healthcare Improvement Act.
Okay. Next question from Pamela is concerning Part D. As Native Americans who have IHS services, are we subject to pay the penalty since it's credible coverage?
I think it might depend on the circumstances and some of the timing. So I think that may be a question for your specific Indian healthcare provider. I don't know if, Rachel, you have any more details on
Yeah,
that.
so IHS is a creditable coverage for Part D, but it does depend on the timing. You have to make sure that you're not signing up outside of your, I can't remember the LEP, what is that? The like your eligibility window. So if you have specific questions about whether or not your like situation would apply, you can feel free to reach out to us. I'll put our tribal affairs mailbox in the chat too, so we can take those more detailed questions. But in general, yes, IHS does qualify as credible coverage.
Okay, our next question is from Kylie. She asked, when does SEP apply if a patient is trying to enroll in Part B outside of the general enrollment period?
So there are a variety of different special enrollment periods or that might apply based on your circumstances. So I think it would kind of depend on your individual circumstances. Let me just get some more information on that. Actually, if we could follow up afterward, that would be helpful if we can give a little more information about the special enrollment periods.
Okay, the next question comes in from Sally, and she asks, how are the private insurance and Medicaid coverage? Which payer is primary?
Don't actually know for sure. I always learn about it in the reverse, which is that, you know, IHS and tribal is the payer of last resort. So I'm not sure who is primary.
Yeah, and if we're talking about commercial insurance versus Medicare insurance,
Yeah.
that I'm not entirely sure about. So we could follow up on that.
And with private insurance, also would want to know if you're not talking about like a Medicare Advantage
right
plan. Yeah. So we'll follow up on that too. Thank you, Annette. So Medicare is primary. That's what I was thinking, but I wasn't sure.
We want to jump back. That question about the special enrollment periods. What was that question again?
If you click on answered.
Yeah.
It's a Part B, enrolling outside the general enrollment period.
Yeah, I think we might want to follow up on that just to make sure we're not giving conflicting information, but you could have a special enrollment period for a variety of reasons. So you move to a new address that isn't in your plan's area. You move back to the US after living outside of the country, things like that. But how that interacts with the Part B enrollment outside of the general enrollment period, I think we want to clarify that.
But there's no tribal special enrollment period for Part B.
Not that I'm aware of.
Yeah. So I know that we're used to that in other parts of Medicaid, other parts of CMS, like Marketplace, for example. We have a special enrollment period for American Indians and Alaska Natives, and we don't have that with Medicare.
Okay, we have a question come in from Sunshine, and she asks, is right now the time where someone was enrolled in an HMO Medicare plan last year can be changed? We are not the PCP, so we're not able to cover the patient, and it has made it difficult for the patients for referrals.
Well, and so the HMO Medicare was probably the Medicare Advantage plan, right? Okay. And we are in open enrollment, but it does end on December 7th. So it can be changed, but we don't have much time left. Are there other, Stacey, you might know this, there are other circumstances under which they can change that plan? And I'm just assuming that this is a Medicare Advantage plan.
Yeah, because I think the Medicare Advantage open enrollment period is generally January 1st through March 31st. So during that period,
it's different, so that
yeah,
they can do it then. Yeah.
Yeah, so they'd be able to switch to another Advantage plan, drop their Medicare Advantage plan. So that does have a slightly different like enrollment window. So I think there was that link in one of the slides earlier on with more information about enrollment periods, because that does get confusing when all the different enrollment periods are. So I would recommend checking out that link.
Okay, so our next question comes from Sally, and she works at Tuba City Regional Healthcare Corporation and noticed receiving providers are changing plan to PPO for patients without patients' knowledge. Can the receiving providers change plan for their plans?
Not sure I fully understand that. So the receiving provider
Hmm.
is somehow changing
Huh.
the member's plan?
Yeah, that's kind of confusing. Let's see. I might need more information about
Yeah.
that. And Sally, I put the Tribal Affairs mailbox, and I'll just go ahead and put my personal email in there too, because we can try to get a better understanding of this question and see if we can help.
So I can go back to the question about the when to change a plan, if you want to change a plan, or what's the time frame. So of course you can do it during this open enrollment period, which ends soon, December 7th. And then there's also and I think Rachel said this, but just to clarify, there's the Medicare Advantage open enrollment period as well. And that one is January 1st through March 31st, when you can change plans.
And it looks like that question came back with some follow-up. So thanks, Bev. Okay, I think that does answer the question. Thank you, Bev.
You're welcome. And then the question about, I know Stacy mentioned about the special enrollment period, so I can run through those really quickly. So you can have a special enrollment period if you move out of the planned service area. You can do it if you are in a plan and that leaves Medicare or reduces the service area. You get, lose, or have to change your dual or LIS eligibility status, and just a few more, leave or lose your employee union coverage. So there's different circumstances, but those are some examples of those circumstances.
Well, if there are no more questions at this time, I'd like to send it back to Beverly for closing remarks.
Absolutely, absolutely. Thank you, everyone. Thanks for your participation in this webinar. I do want to remind you again that all materials related to this webinar will be found on the Spotlight page, and that is at AIAN Outreach and Education website. You can find that at go.cms.gov/AIAN. And further materials can be found, or past All Tribes calls will be found under the All Tribes tab. And also, as always, you can submit any inquiries to our division, the CMS Division of Tribal Affairs. That mailbox is tribalaffairs@cms.hhs.gov. And again, for folks who want the presentation prior to me posting it or us posting it on our website, you can email me directly at beverly.lofton@cms.hhs.gov. Thank you.